Thank you for joining us for the Stanford Women's Health Lunch. I'm Andra Blumkals, Chair of the Department of Emergency Medicine here at Stanford. We are so happy you took this time to focus on your health and yourself. As women, we are often so busy caring for others. We put ourselves last when it comes to self-care. How many of you have put aside your health care screenings over the past 2 years, given up your own exercise routines, gotten tired of preparing healthy foods? In truth, I've done very little to care for myself during the pandemic. But what has become abundantly clear is that COVID will be part of our lives for some time. As you see today, all of our speakers are wearing masks when they're not presenting. They are all vaccinated and boosted. We will have to learn to live with the ebbs and flows of normalcy this virus brings and restore our self-care practices. Make that appointment for your mammogram. Schedule a colonoscopy or your routine blood work if you're overdue. Start exercising again, even if it's just a short walk or a few stretches. Genetics aside, so much of our own health is within our control. We can all mitigate our risk factors and optimize our health, no matter what our age. As an emergency physician, I see people with more advanced stages of disease this year after skipping routine healthcare screenings or struggling to maintain chronic conditions like diabetes, heart disease, obesity, health issues that sometimes could have even been avoided altogether. For the next hour, we will learn what we can do now, starting even this afternoon, this week, or in the coming months ahead to improve our health and help prevent the onset of chronic conditions. In our pre-event survey, we learned about the lifestyle changes many of you plan in 2022, from a plant-based diet to exercise, yoga, and mindfulness practices. These small behavior modifications are critical to your health and wellness. I am thrilled to welcome 4 of my Stanford colleagues here who will address women's health from head to toe. With just 60 minutes, we can't possibly cover every part of the body, so today we will be focusing on our feet, heart, bones, and brain. First, we will start with a part of our bodies that we often ignore. Most of us don't spend too much time worrying about our feet, but they are woefully neglected and often downright abused. Elizabeth Riley, clinical assistant professor in the Department of Orthopedic Surgery, helps maintain patients who manage their foot issues almost every day. Thank you, Dr. Riley, for joining us today.
Andra, thank you so much, and thank you to the organizers of this fantastic event focusing on women's health. It's going to sound really silly, but I'm very pleased to represent the toe in this series. Feet are unloved, they're just malaligned. When we think of the foot, it does not get the love that it deserves. We believe in foot and ankle. That is the foundation of our body. It's what grounds us. It's what gets us where we need to go. Spoiler alert, many of my colleagues are going to tell you how important it is to get out and walk for a very certain time during the day. And then we need to take care of it. So like my clinic, I like to talk about anatomy first. We talk about the 26 bones, that's on each foot. We talk about the 30 joints, and then there's over 100 pieces of soft tissue. So when you do that math and you double it for the pair, it is really quite impressive. My best part of trivia is the 52 bones that make up the feet and ankle actually comprise the 25% of the entire bone structure of our human body. And even after 20 years, every time I say it, it amazes me. When I polled my colleagues about our discussion of feet and women's health, a pattern emerged. So what I decided today, if it's okay, is I would do sort of an old school top 5 list of the most important things that we'll see as your clinicians and sort of give us a little brief intro into each, and then we'll have some questions at the end. So coming in at a number 5 is onychomycosis, or as we'll call it, the dreaded nail fungus. I apologize, this is over lunch, but it's definitely something that has to be talked about and addressed. Nail fungus is the most common nail complaint of adults. It is an unsightly issue, I get that. There is aesthetics involved. It does get yellowed, crumpled, thickened. It becomes very difficult to maintain as the patient. But also it's a serious medical issue. It does predispose our patients to bacteria and skin infections. If we get what we call comorbidities, diabetes, vascular disease, it's definitely an issue. There are many over-the-counter treatments. As a rule, not a big fan. So what we prefer is you see a clinician, you get a little sample taken, really easy. We identify the fungal elements, and then we can have prescription strength topical or orals, depending on what's best for you as the patient. Coming in at number 4 is heel pain. Heel pain you'll see in male and female, it's pretty evenly divided, but the reason we'll bring it up, because if you've ever had it or you've had someone who has had it, it's awful. It's that first thing in the morning where someone's stabbing you in the bottom of the heel with a knife, gets better through the day, end of the day, you can barely walk. The classic diagnosis is called plantar fasciitis. Plantar means bottom of the foot, fascia is fat, and itis means inflammation. So we all have a plantar fascia. It goes all the way from our heels down to our toes, and it's called the windlass mechanism. What it is like a giant rubber band. So every step you take, this plantar fascia pulling, contracting. And so if we have too much arch, too little arch, the dreaded shoe gear talk, you go barefoot too often, this poor thing gets tired and overworked, and then it lets you know. If you do go to a clinician, you'll get x-rays done very commonly. You will see what we call a spur in the bottom. I would like to clarify, this will never be what hurts you when you have heel pain. Patients love to look at them. We love to talk about them. But if you and I are going to treat heel pain, we're going to talk about the itis, the inflammatory process. And so we have avoiding barefoot, shoe gear. We have anti-inflammatories. Don't be mad at me, but we have the dreaded steroid injection when it's appropriate. And then always, as the absolute last defense for heel pain, should be a surgical intervention. Coming in at number 3 is a Morton's neuroma. This might sound very specific, but talking to my audience, it's very specific for females. It's a pinched nerve in the ball of the foot. Now, when you describe it that way, it doesn't sound like much, but if you've had one, I've had one, they're excruciating. People will describe it as sort of a burning pain in the ball of the foot, walking on a bubble or crumpled sock. Good news, lots of conservative treatments. Don't be afraid to tell your doctor, because that is one we can definitely cure for you. Number 2, nobody's going to be shocked in this audience, will be bunions. Bunions happen to everybody, but they are a woman's issue. If you look at the literature, 10 to 1 female to male. It's that large bump that will get near the big toe. What I like to dispel is sort of the myths of bunions. It's not a bone tumor or a bone cyst. It's actually a malaligned bone. This as women will be our genetics, our structure, and then we have our talks like shoe gear and other issues. Don't be afraid to tell a doctor about bunions. There are choices, not as many as I'd like to offer, but we have choices. And then coming in at number 1 is shoe gear. If you've ever had a talk with women, it's always shoe gear. It's not the enemy people think it is. I describe it as sort of good, better, and best scenarios. Good is a nice heel, 1.5, 2 inches, blocky, a little bit of an arch support. Better, flatter, 1 inch or less, really good arch support. And then best is ditch the heels and get yourself a really good pair of running shoes. I know nobody wants to hear that, but that is your best answer. Now, so I hope I didn't bum too many people out, but I will leave you on hopefully some good notes. Number 1, if you really say, what can I do, Elizabeth? Avoid barefoot. That's your best friend. Heel pain, arch pain, bunions, you name it, just put some shoes on. We were crazy busy during COVID because everybody was at home working barefoot. So please, please, please wear shoes indoors and out. I would tell you self-care, get a pedicure, love it. Just make sure you know where you go, you trust your stylist and your manicurist, and they have really good sanitary practices. But probably the most important things I would like to tell you is it is not normal to have foot pain. I do believe it has been normalized in women, and it isn't. It is not great to hurt. If it is hurting you, if it is a quality of life issue, do not be shy. Let us know. We are here to help.
Awesome. Thank you so much. I think we've seen everybody sort of move their feet a little bit when you were mentioning the type of shoes and things, and we'll just hide. It's all right. All right. Well, that's a wonderful reminder on an often sort of forgotten topic or forgotten medical problem. Yep. We have a few questions that our audience pre-submitted. So you mentioned bunions.
Yes.
What are the options other than surgery?
So limited, which again, I'm really sorry to tell you. So since bunions are truly a structural abnormal bony abnormality, I can't push it, inject it, therapy it back. So we talk about shoe gear, make it happy, make it comfy, bunion splints, toe shields, orthotics, don't underestimate their power. But don't be mad at us when none of that makes it go away.
Okay, all right. Another question. I have osteoarthritis of my big toe, which is slowly deforming my foot. What can you recommend to prevent further damage so I can continue to walk?
So if we'll think of the big toe as a tiny knee or a tiny hip, it is the same exact arthritis that you'll get, like the rest of my colleagues in Stanford Orthopedics would be very happy to help you with. But then think of it as a tiny knee that you're putting every single ounce of your weight on 10,000 steps a day. So it's that bone-on-bone joint arthritis that's just incredibly painful, limits your range of motion, limits your walking. Conservatively, it's orthotics. I know, they're not fun. Everyone, like, their eyes glaze over when I tell them. But for osteoarthritis of the big toe, there's something very specific called a Morton's extension. And it's like putting this very rigid beam underneath the big toe. You're still walking, running, do whatever you want if you have to, but it takes away that irregular range of motion into that joint, and it can be an incredibly useful tool. If you're very much anti-orthotics, which would bum me out, but I get it, you can actually talk to your provider and get a sort of a singular Morton's extension that I can get into better shoe gear as well for you.
Okay, okay. Is it possible to walk too much?
No, that's a hard no. And again, another spoiler alert, but I'm pretty sure every colleague on this panel is going to tell you the same thing. I need you to walk. For there's circulation, the nerves, right? Exercises the legs, the heart, the bone health. My goal is do it, but how can I do it? Happy, safe, comfortable. That's our job.
Blisters?
Friction, pressure, like better shoe gear.
Okay. I thought I found an excuse.
Darn it. Yeah, that's a hard no.
Okay. How can I relieve the pain of Morton's neuroma?
So Morton's neuroma, we chatted earlier, that is a little bit of a pinched nerve. Again, don't underestimate, even though it's one of those, size doesn't matter, even though it's this wee little nerve in the ball of the foot, it will bring you down quicker than anything. So again, that's the one thing. I do have a lot of great conservative measures, padding, shoe gear. If you can tolerate them, Hoka sneakers, because they have a very special thing called a rocker bottom that really alleviates the pain of a neuroma. And then there is, again, it's lunchtime, so I don't want to upset anybody, but we do have a series of injections called neurolysis. I did it to my own self, so I'm a big fan of, I know, it took me a while, but I got there, and it works like a charm. That's where we can detonate with a series of injections with alcohol. And then there is a surgical intervention as well. The one pearl for me for Morton's neuroma is please do not get a steroid injection. That sort of used to be the standard of care, and we've learned we're actually not helping them. Literature tells us the success rate is super lousy, and we've actually created some harm we didn't mean to. So if I left you with anything, no steroid injections for neuroma. Please have your practitioner or clinician talk about some other really great, easy, conservative measures.
Awesome. Thank you so much for those tips.
Thank you.
Excellent. Next, I'm happy to introduce Sandra Tsai, an internal medicine physician who specializes in cardiovascular disease prevention. Often when we think about heart disease, especially cardiac arrest, we think about men. But women are not immune to heart problems. Stress, diet, and exercise, and even sitting too long, all play a role in the health of our hearts. Dr. Tsai is here to talk about opportunities within our control in preventing heart disease and understanding our risks. Dr. Tsai, welcome so much.
Thank you, Dr. Bloom-Combs, and I'm very happy to be here to tell women that the majority of heart disease is preventable. So women can reduce their risk of heart disease by 80% through a healthy lifestyle. The Nurses' Health Study, which is one of the largest prospective study of women in the United States, found that women at the start of the study who had no signs or symptoms of cardiovascular disease and they were followed for an average of 14 years, the women who adhered to a low-risk lifestyle had 80% fewer coronary events. So this just tells you how powerful a healthy lifestyle can be. Unfortunately, heart disease is still the leading cause of death among women, as it is for men, but a lot of women are not aware of their risk for heart disease. And it's not just a concern for older women. Heart disease does affect women who are younger than 65 years old. We've learned a lot over the past couple of decades as more and more women have been enrolled in cardiovascular disease clinical trials. We've learned a lot of important things about heart disease in women. One of the things we know is that when women appear or when they have a heart attack, they can actually have less common symptoms. So even though chest pain is the most common symptom, some women may present instead with jaw pain, upper back pain, abdominal pain, indigestion, severe fatigue, or even passing out. The other thing we know is that women can have unique risk factors. These risk factors are called non-traditional risk factors, also known as emerging risk factors, but they're just as important as traditional risk factors. They're so important that they have definitely made it into our cardiovascular disease prevention guidelines. Clinicians are supposed to ask their women patients about these because if they do have these risk factors, they're at increased risk for early heart disease. So some of these risk factors include adverse pregnancy outcomes, also known as APOs. And some of these APOs include gestational hypertension. The more severe form is called preeclampsia, gestational diabetes, delivering a baby less than 37 weeks gestation, or even pregnancy loss. We're not exactly sure what drives the early risk for heart disease, but it's probably a combination of the APO is an independent risk factor, as well as women who have APOs already have underlying cardiovascular risk factors. Another risk factor is breast cancer treatment, specifically breast radiation and chemotherapy with anthracycline medication. So breast cancer radiotherapy, especially if it's on the left side of the left breast where the heart is, will damage the heart arteries and the heart. And then anthracycline chemotherapy can cause a woman to be at risk for heart failure even decades after the treatment is completed. Another risk factor is autoimmune disorders. So the reason this is really important is because autoimmune disorders disproportionately affect women. And we know that inflammation is a key factor for atherogenesis and plaque development in the arteries. And autoimmune disorders are very inflammatory. Another risk factor is premature menopause. So this is when menopause happens to a woman when she's less than 40 years old. So the average age of menopause is 51, and estrogen is protective. So if a woman loses her estrogen a decade early, she's at risk for early heart disease, especially if she does not have that estrogen replaced. And then menopause is a transition for every woman, and it is already associated with an increase in cardiovascular risk factors. So a lot of women during this time of a decline in estrogen, they'll find weight gain, especially in the midsection. And we know that weight gain in the midsection is associated with insulin resistance. And this brings abnormal cholesterol. This can also bring hypertension. And if a woman is already at risk for these factors prior to menopause, she often will see overt diabetes and overt hypertension happening in menopause. What can women do? What can you do to reduce your risk? I always recommend that women get a cardiovascular risk assessment, especially if they have cardiovascular risk factors and if they have a family history of early heart disease in a first-degree relative. We do this at the Women's Heart Health Clinic and the Preventive Cardiology Clinic here at Stanford. During the visit, we take a comprehensive look at all your risk factors and we come up with a plan to mitigate your risks. We use a multidisciplinary team that might include our dietitians, our behavioral therapist, and maybe even a genetic counselor. And sometimes we'll also ask you to do some additional testing to further assess your risk. The other thing I would really love women to do is definitely try and take control of the risk factors that you do have control over. For example, don't smoke. If you have high blood pressure, control your blood pressure, control your cholesterol and your glucose. We also have control over how physically active we are. So be physically active and limit your sedentary activity or your sedentary time. So the physical activity guidelines are a minimum of 150 minutes of moderate intensity activity. So this is something that will get you breathing a little faster, your heart rate up, or 75 minutes of vigorous activity such as cycling or jogging, or a combination of both per week. In addition, there's a minimum of 2 times per week that we should be doing resistance training for all our major muscle groups. And for those who want added benefit, definitely do more. The other thing that's really important, the evidence is very, very clear, sedentary time and prolonged sitting time are detrimental. So it can offset all of the gains you get from physical activity if the rest of the day you're sitting and you're sitting for a prolonged period of time. And for other women who want even additional metabolic benefits, we do know high intensity interval training has metabolic benefits over just the steady cardio. The other thing is eat a healthy diet. But the most important thing about a healthy diet is it needs to be sustainable. If it's too restrictive, you're just not going to be able to stick with it. Your diet should be low in processed foods, processed grains and sugar. It should be high in whole grains and fiber from fruits and vegetables. And it definitely should contain good fats from nuts and fish, and definitely limit red meat. And I know a lot of women worry about their weight, but the most important thing to really think about is your waist, because it's the weight that's inside the waist that is the most damaging. It really increases your risk for having diabetes and heart disease. Thank you.
All right, great. Thank you so very much. We have a few questions from our audience. When it comes to exercise, you gave us a lot of details. What is the ideal combination of strength training and cardio for, let's say, somebody over 40?
Yeah, so a lot of women over 40 will notice that their exercise tolerances decline, and a lot of women will notice that they're just not as strong. So just like the physical activity guidelines have said, women really, especially over 40, really need to be paying attention to lean muscle mass and maintaining it, because every year we're losing a little bit more. And the more lean muscle mass you lose, the worse your metabolism gets. So that's one of the biggest things is 2 days per week, definitely at least a minimum, resistance training. And then the 150 minutes of moderate or 75 minutes of vigorous, and limiting the sitting time. And I definitely think a lot of women who feel like they would like to do a little extra, the high intensity interval training.
The sitting time seems almost unreasonable in this
know,
idea with like Zoom everywhere, right? I mean, it's like almost impossible, but how does stage 2 hypertension without treatment affect the heart in a few years?
Hypertension is such an important topic to talk about. It's so prevalent, and I think a lot of people don't realize how important it is to control it. So just so everybody knows, stage 2 hypertension is defined as a blood pressure of 140/90 or greater. And this is the new cutoff. In 2017, the hypertension guidelines changed. They moved the hypertension used to be defined as 140/90, and they lowered to 130/80 because there was good clinical trial data showing us that those who have a lower hypertension have fewer cardiovascular events. So now stage 1 is 130/80, but normal blood pressure is less than 120/80, just so everyone knows. If we don't treat hypertension, especially if it's very elevated, it does damage the heart, because just like any other muscle in our body that has to work really hard, it starts to get thick. So what can happen is untreated hypertension can lead to left ventricular hypertrophy and ultimately heart failure and atrial fibrillation. And the other thing it does is it's very damaging to the arteries, and it promotes atherosclerosis and plaque development, which can then put people at risk for heart attacks and strokes.
Okay, whoa, all right. Are heart palpitations a cause for concern? And people describe it as like my heart's jumping inside my chest.
Yeah, so heart palpitations are so common. It's probably one of the most common reasons people see their practitioner. The good news is most palpitations are benign, especially if palpitations they've been happening for a lot of many years, and they're not associated with any concerning features, like no chest pain, no fainting, no shortness of breath. Those palpitations are they're most likely going to be benign, but all palpitations should be evaluated because there's many different causes for them. So we normally evaluate them with a 12-lead EKG or an electrocardiogram, and also an ambulatory cardiac rhythm monitor. And as long as these things look normal, we can just reassure the person that the heart palpitations are not something to be concerned with. If everything is normal, sometimes the jumping or pounding that you feel in your chest is actually due to high blood pressure.
Oh, wow, okay. What about a heart murmur? If I've been diagnosed with a heart murmur, is that a risk factor for heart attack?
Heart murmurs are really worrisome, I think, to people, but they are not always from a negative cause. And heart murmurs do not predispose people to having heart attacks because the etiologies are different. Heart murmurs are the sound that we hear of blood flowing through a valve from one chamber to the next, and sometimes the blood flow is very innocent sounding, and we call those innocent murmurs. Other times the flow sounds much more turbulent because the valve is very small and stenotic, or it won't close well. So all heart murmurs should definitely be evaluated. And then heart attacks are due to atherosclerosis or plaque development in the heart arteries. So there are different etiologies, but both should definitely be evaluated. Yeah.
Thank you so very much.
Thank you.
Next, please welcome Joy Wu, an endocrinologist at Stanford who will talk to us about bones. For years, brittle bones have been considered a foregone conclusion of aging. But just as we can build muscle, we can build bone strength as we age. Dr. Wu will discuss the risk factors that can impact bone strength and describe how we can optimize our bone health. Dr. Wu, welcome.
Thank you, Dr. Blomkons, for that introduction. It's great to be here. There's a common misperception that fractures have to be an inevitable part of aging, and I'm here today to talk about the things we can do to prevent that. Our bones do so much for us. They provide mechanical support, they protect our internal organs, they store minerals, secrete hormones, and help produce blood cells. As we age, the amount of bone that we have decreases. This can make bones more fragile and easier to break. This state of fragility is called osteoporosis and is very common. Half of women and about a quarter of men over the age of 50 can expect to experience a fracture due to osteoporosis in their lifetime. Sometimes these fractures can be devastating. Fewer than half of adults who suffer from a hip fracture ever walk independently again. But with proper screening and management, we can prevent many of these fractures from happening. How can you know if you're at risk for osteoporosis and fractures? The risk factors include advancing age, low bone mineral density, low body weight, smoking, excessive alcohol use, a personal history of a previous low-impact fracture, or a parent who has had a hip fracture. Osteoporosis can also be brought on or accelerated by diseases such as rheumatoid arthritis or medications like glucocorticoids. The most commonly used screening test for bone density is called a DEXA scan. It takes 10 minutes, doesn't hurt, and involves minimal radiation, far less than if you were receiving an X-ray. Who should have a bone density test? Women over the age of 65, men over the age of 70 to 75, any adult who's had a previous low-impact fracture, or significant risk factors. So what can we do to improve our bone health? Let's start with the lifestyle interventions. First, we can ensure adequate calcium and vitamin D intake. Calcium is an important component of bone. It's part of the mineral that keeps bones strong. The recommended amount of calcium for most adults is in the range of 1,000 to 1,200 milligrams a day. This can be from diet, supplements, or a combination. Calcium-rich foods include dairy products like milk, cheese, and yogurt, dark green leafy vegetables, and there are fortified foods like cereal and juice. If you're unable to get enough calcium in the diet, perhaps due to lactose intolerance, or if you're on a vegan diet, then you can get your calcium through supplements. Then there's vitamin D, which is important for helping our bodies to absorb calcium. You can get vitamin D in fortified foods or in supplements, and the recommended amount for most adults at risk for bone loss is 800 to 1,000 international units a day. The other very important lifestyle intervention is exercise. We've heard from Dr. Asai that the guidelines recommend about 150 minutes a week. I tell my patients to aim for 30 minutes a day of vigorous exercise. Specifically to help our bones, 2 to 3 times a week, that exercise should focus on strength training with weight or resistance. Balance and flexibility are also important. For some, the risk of fracture is high enough that even lifestyle measures will not be sufficient. That's when we have to consider medications for osteoporosis. The most commonly prescribed medications target bone breakdown and include bisphosphonates, marketed in the US as Fosamax, Actonil, Beniva, and an intravenous form called Reclast. There's also denosumab, which is marketed as Prolia. These are extremely effective medications for improving bone density and lowering fracture risk. There are also bone-building medications for more severe cases, usually prescribed by a specialist. Finally, I'd like to touch on optimizing bone health for patients and survivors of breast cancer. Many patients with breast cancer are at risk for osteoporosis. This is both because chemotherapy can induce premature menopause and because endocrine therapies that lower the risk of breast cancer recurrence can lead to significant bone loss and a higher risk of fractures. Fortunately, the most commonly prescribed osteoporosis medications can be used safely and effectively in cancer patients. As a breast cancer survivor myself, this is a topic that's personally meaningful to me. It's something that I therefore focus not only on in my clinical practice, but also in the research lab that I run here at Stanford. In my lab, we've been studying how to use stem cells to repair bones and how to prevent breast cancer from spreading to bones in advanced stages. For example, we found that recombinant parathyroid hormone, which is approved for the treatment of osteoporosis, can decrease bone metastases from breast cancers in mice. My research has benefited tremendously from being here at Stanford, thanks to the collaborations I have with some of the best scientists and oncologists in the world. So my final take-home message, don't assume that bone loss and fractures are an inevitable part of aging. We have effective treatments to improve bone strength, so talk to your doctor about getting screened. For women, if you're over age 65, or younger, if you have risk factors such as a previous fracture or medical conditions or medications associated with bone loss. Thank you.
Thank you. And it's great to know that bone density is somewhat in our control.
Absolutely.
So we have a few questions that were submitted. So you talked about some of the treatments for osteoporosis, but there's also a lot of anxiety and confusion over the safety of these medications. So as a patient considering these medications, what might be some strategies to maximize the benefits and minimize the harm?
That's a terrific question and probably the most common that I get in my clinic. So used properly, medications for osteoporosis are extremely safe and effective. For the bisphosphonates, as long as you're not at extremely high risk, it's generally recommended that we consider a drug holiday after about 5 years of treatment. And by a drug holiday, I mean stopping the medication for 1 to 2 years. This allows the risk of some very rare side effects to return to baseline so that we can safely restart those medications, and that way we can maximize the benefit while we minimize the risk. For denosumab, it's a little bit more complicated. Long-term denosumab use also carries some rare side effects, but it's important to know that denosumab cannot be stopped abruptly because there can be a rapid rebound loss of bone. So if you're thinking about stopping denosumab, it's important, if possible, to switch to a bisphosphonate first for at least a year.
Okay, great. Thank you very much. Can you talk about supplements and how they improve bone health? Because the racks on the store are just bewildering. They go on forever.
Oh, I know. There are so many kinds on the shelves. It's overwhelming. So let's start with calcium. For most people, I recommend calcium carbonate. You can find that under brand names like Oscal or Tums. The most important thing is to check the label for the amount of elemental calcium. Most people need about 1,000 milligrams a day, but our bodies can only absorb maybe 500 to 600 milligrams at a time. If you're taking acid blocking medication, like a proton pump inhibitor or an H2 blocker for reflux disease, then you'll want to take calcium citrate, which doesn't depend on acid to be absorbed. There are other kinds of calcium supplements out there. So again, the most important thing is to check the amount of elemental calcium on the label. For vitamin D, most people need about 800 to 1,000 international units a day. This can be in a once-a-day pill or in a combination. So some people have vitamin D in their calcium supplements or a multivitamin, and you just want to add up the total. Some people do take medications that rev up the metabolism of vitamin D, so they may need higher doses. And you can take vitamin D2, which is a plant-based supplement, or vitamin D3, which is the same version that we make in our own skin in response to sunlight exposure.
Okay, thank you. And how do medications like hormone replacement therapy and chemotherapy affect our bone health? And what can we do to mitigate the side effects of those medications?
Great question. So while hormone replacement therapy does have beneficial effects on bone, these are outweighed by some increased risks, for example, of breast cancer and cardiovascular disease. So we no longer recommend hormone replacement therapy as a treatment for osteoporosis because we have better alternatives. Chemotherapy includes a wide range of medications used to treat various kinds of cancers. Some can have direct toxic effects on bone, and others can indirectly cause bone loss, for instance, by causing weight loss from nausea or inducing premature menopause. Probably the most commonly prescribed medications that can cause osteoporosis are glucocorticoids, like prednisone or hydrocortisone. These are anti-inflammatory medications that are used to treat a variety of conditions such as asthma, autoimmune disease, inflammatory disorders. So it's important to talk to your doctor about whether any medications you're taking might be affecting your bones.
So what I'm hearing you say is that even though if you might have to take medications for another condition that might affect your bone health, there are ways to balance
Absolutely.
those things
Absolutely.
so that you can still treat your
Right.
bones and whatever this condition
If those
is.
medications are essential, then we can work with your other doctors to come up with a plan to protect the bones and get you the most benefit from those other medications.
Fabulous. Excellent. And what type of exercise is best to strengthen our bones? Walking, weightlifting?
Yeah, so as we've heard already, there's so many benefits to exercise. And I recommend about 30 minutes a day. I think it's important to find something that you'll enjoy and that you'll do. So that can be walking, running, swimming. 2 to 3 times a week, we want to focus on strength training to build our bones and our muscles. And again, there are many options. This can be resistance bands, it can be free weights, it can be weight machines. Right now, a lot of us are avoiding the gym because of the pandemic. So online videos that you can do at home are a great resource. The general idea is to work out all the major muscle groups, both upper body and lower body. And unfortunately, it has to be challenging.
Challenging. Okay, great. And I've heard, does it have to be high impact?
It does not. There are low impact ways to build strength.
Okay, wonderful. Okay, great. Our final speaker this afternoon is Andrew Huberman, a neurobiologist at Stanford who has a popular podcast focusing on the brain. He is here today to talk about brain health and how we can maintain and improve our cognitive function as we age. Welcome, Dr. Huberman.
Great. Well, thanks for having me here, and thanks everyone for being here. Today we're going to talk about the brain, but we're actually going to talk about health for your entire nervous system. So just in 1 minute, I'll tell you a little bit about your nervous system. That includes your brain, which is the stuff inside your skull, of course. Most people don't realize this, but there are 2 bits of brain that are outside the cranial vault or skull, and those are your neural retina. So your eyes are actually part of your brain, and that will become important in a few minutes as to how you can use your eyes literally in order to improve brain health and function. And then, of course, you have your spinal cord, which is inside the bony casing of your spine, and then all of the neurons, which are just nerve cells in your brain, your eyes, your spinal cord, those connect to different parts of your body, and then different organs in your body, including your heart, your lungs, your pancreas, your spleen. All the organs also are communicating back to the brain. So the real role of your nervous system is to allow you to sense things, perceive things, think, remember, plan, and generate action, and also deploy all the sorts of good stuff that, when your immune system is active, it's because your nervous system told it to be active. So how can you keep this incredible thing that we call the nervous system healthy and functioning at any age? Turns out there's some basic approaches to that. In thinking about how to adjust one's human health at any level, there are really about 5 categories of approaches. The first are going to be behaviors, so things you're going to do or avoid doing. Nutrition, so basically what you eat and perhaps also what you try and avoid eating. Supplementation, we heard about today. Prescription drugs. And then there's a lot of excitement nowadays about so-called brain-machine interface, the idea that maybe someday there'd be a little chip that you could insert behind your ear and it would allow you to remember things faster or learn more quickly. That technology is still on the horizon, but I think that day will come. Okay, so today we're going to talk mainly about behavioral tools that are very powerful for improving the health of your nervous system. And the way to think about these tools is that if you perform them regularly, ideally every day or most days, they more or less raise the tide of health on your nervous system. What do I mean by that? You can think about your nervous system as a boat, and that boat can only get out of port and out to ocean and function really well on a consistent basis if the tide is high enough. So think about doing these behaviors as a way to raise the tide and allow your nervous system to function as well as it can, regardless of what you use that nervous system to learn and think about and do. So the number one tool that I recommend to everybody to improve the function of your nervous system and actually your hormone system, etc., is to get bright light, ideally sunlight, in your eyes within the first hour of waking. And certainly if you wake up before the sun comes out, to get outside as soon as you can. This is true also on overcast days. So believe it or not, on a densely overcast day, there are more photons, light energy coming in through that cloud cover than you could ever get from bright indoor lights, unless you've gone out and bought a daytime simulator or something, which I don't recommend you even have to do. Most people can just get that sunlight exposure for about 10 minutes every morning, get outside, take off your sunglasses if you can safely do that. Most people can do that. Don't try and do this through a window or a windshield. It's fine to wear corrective lenses like contacts and eyeglasses, if anything, that will focus the light on your eyes. The reason this is important is that you have neurons in your eye. They go by a particular name, melanopsin cells, but that's not important. They communicate to a little area of your brain above the roof of your mouth called the hypothalamus, and they send a wake-up signal to your brain that coordinates the action of a lot of hormones and neurotransmitters and things that make you feel alert and active during the day. And they also set a timer on some of the sleepiness signals that are going to arrive about 16 hours later, and sleep is vitally important to brain function. So in fact, if you don't get bright light in your eyes early in the day, often enough, you can actually become jet lagged at home, and this is happening a lot when people are working from home, and jet lag has all sorts of negative health issues. So even if you're not doing shift work, many people have disrupted circadian rhythms. The other thing is try and avoid bright light exposure of any color, not just blue light. I'll repeat that, not just blue light. We've heard so much about how bad blue light is. Blue light is actually great during the day in the morning. It will wake up your whole nervous system and body in the right ways. But between 10 p.m. and 4 a.m., avoid bright lights of any kind, especially overhead lights. Those have a detrimental effect on things like dopamine, on learning and memory. They can cause various stress effects. If you look at bright light once, no big deal. But if every night you're waking up and flipping on bright lights, that's not going to be good for your brain and your nervous system health. So really dim those screens at night, turn down the overhead lights, use desk lamps, or use no light at all if you can do that safely. The other thing is get adequate sleep. The brain remodels and changes. It undergoes what we call neuroplasticity, which is its ability to learn throughout the lifespan, but only if you get adequate deep sleep. And one of the best ways to get adequate deep sleep is to follow the light viewing recommendations that I just talked about a moment ago. And then the other thing is to lower the temperature in whatever sleeping environment you're in the room by about 1 to 3 degrees. Make that room cool, because your body actually needs to go down in body temperature in order to fall and stay asleep. A lot of people rely on supplements like melatonin, which will help you get to sleep, but won't keep you asleep. And in fact, I personally am not a big fan of melatonin supplementation, except in specific cases, because it has a lot of other effects, and you really have to check the quality of the supplements and so forth. Try reducing the temperature in the room. You can still get under warm blankets. You'll kick off those blankets as the night goes on, but try and lower the temperature in the room. The other thing we've heard a lot about today, so I'll just briefly cover this, which is the brain is a very metabolically demanding organ. That means it needs blood supply to bring glucose, or even if you're on a ketogenic diet, you still need great blood supply to your brain. Actually, when you sleep at night, there's a clearance of a kind of sewage system that gets cleaned out at night. It's called the glymphatic system, from lymph, but of these cells in the brain that we call glia, so the glymphatic system. So you can actually wash out the debris in neurons during deep sleep. One of the things that can enhance the function of the glymphatic system and enhance circulation to the brain, offset the probability of stroke and all sorts of things, is to get 150 minutes to 180 minutes per week total of what they call zone 2 cardiovascular exercise. So that would be cardiovascular exercise that would allow you to, if someone said, "What's your name?" that you could say it, but you probably couldn't say a whole sentence. So if you're walking and talking to friends and you can tell a whole story, you're not going intensely enough. If you're completely out of breath and you can't say your name, then that's probably too intense. So right in that zone 2, as they call it, 150 to 180 minutes per week. Some people like to use wrist monitors and heart rate monitors, but you don't need that, okay? Use your ability to speak your name or a complete sentence as a guide. It's also been discussed today, and it's quite clear that resistance training of some kind is important. The numbers that seem to come out of the literature, at least by my read, for sake of brain health, is that in order to maintain muscle mass, you want about 6 working sets, those sets that are challenging, per muscle group per week. So you could divide those up, or you could do more if you like, provided you can get enough sleep and recover from that. But that's the minimum, and I gather most people, including myself sometimes, are not getting that minimum, but that's important. Also, the zone 2 cardiovascular exercise. 2 quick tips about respiration and breathing. We put food into our mouth, it gets digested to deliver nutrients to all the cells of our body. Likewise, we need to get oxygen to all the cells of our bodies. We don't have gills, so we wouldn't take food and cram it in through our ear. We have to put it in through our mouth. Likewise, you need to get air into your system, to the lungs, and then it goes from the lungs to your blood, and then oxygen can be delivered to all the cells of your body, and you can also discard the other gas, which is called carbon dioxide. Breathing properly is essential. The proper way to breathe for sake of health, immune system health, brain health, cognitive function can actually be enhanced by becoming a nasal breather. Now, unless you're talking or eating or exercising hard, try and breathe through your nose. If you have challenges breathing through your nose, breathe through your nose more because the sinuses can dilate. This is based on excellent work that's been done by people here at Stanford and elsewhere. There's a terrific book out there called Jaws, A Hidden Epidemic that has authors all from Stanford Med and Stanford. You can check that out. It will also detail some of the enhancement of cognitive features of the face, higher cheekbones. Believe it or not, tooth health is improved by nasal breathing, so become a nasal breather if you're not already. And then the last thing is stress. Stress is inevitable. We would all love to get regular massages, regular exercise, eat perfectly, have great social connection, get sunshine. But listen, even if we're doing all those things, sometimes we're not able to do all those things all the time. And there's this irony of stress, which is when we are very stressed, we tend to not do the things that we need to do to offset stress. For that reason, my laboratory and Dr. David Spiegel's lab, he's our associate chair of psychiatry here at Stanford Medicine, have been working on different breathing patterns that can be used to adjust stress in real time. So when you're feeling stressed, the best tool that we are aware of is to use what are called physiological sighs. So this would be 2 inhales through the nose and a long exhale through the mouth. So yes, I'm giving you permission to mouth breathe here. So anytime you're feeling stressed, you do this. You inhale deeply through the nose, and then you sneak in a little bit of extra air, and then offload all that air through the mouth. The reason is physiological sighs are actually something that you do about every 5 minutes or so subconsciously. You also do it in sleep. Your lungs are not just 2 big bags of air. They actually have billions or hundreds of millions, I should say, to be accurate, of little sacs. And when we get stressed, those little sacs collapse and they have some liquid inside, so it's hard to reinflate them. So if you've ever tried to open up a kid's balloon at a kid's party, you have to sometimes blow twice. And that reinflates those sacs, and then you can offload carbon dioxide, which is associated with the stress response. So you sometimes only need 1, maybe 2 of those physiological sighs to adjust your stress in real time. And this can be very beneficial. It doesn't take away the need to do all the other stress relieving activities, but it will help. It works the first time, it works every time, and you have dedicated neural machinery in your brain for generating these physiological sighs. So it's not a hack. You're taking advantage of a naturally occurring machinery that you and everybody else has. So those are the things. I listed 5 of them. View sunlight, avoid light late at night, try and reduce the temperature of the room so you can get to sleep at night. I talked about the exercise recommendations, be a nasal breather, and cyclic sighing is the other respiration or breathing advice.
Okay, thank you so much. And thanks for listing out those things. And it's going to be tough to try to do all of them in one day, but we'll give it a shot. So a few questions from our audience. Okay, are there any websites or apps that you would recommend using to challenge the brain? And obviously I've heard mixed things about whether those actually help mental acuity.
Yeah, so for sake of learning, I mean, there are a number of apps and commercial approaches that are available out there to enhance learning and memory. Personally, I think the best way to enhance learning and memory is to take advantage of the 50+ years of excellent research on so-called neuroplasticity, the brain's ability to change in response to experience at any age. Some of this work, much of this work was actually done here at Stanford and Stanford Med. Work from Eric Knudsen, work from Carla Schatz, has shown that there are really 2 phases to learning. The first phase is to get very focused on whatever it is you're trying to learn. Now, if you're a child or you're younger than 25, you can learn things passively. Just passive exposure to things will change the brain. The unfortunate truth is also that at any age, if bad things happen to us, that will also change the brain. One trial learning is very good for things that could be dangerous or traumatic or bad for us. And thank goodness that's the case, because we wouldn't have to go through multiple trials of those things in order to learn. But if you want to learn things, math, a new language, how to dance, a new sport, how to relate to others better, the key is to focus very intensely during the learning bout, and then to access deep sleep, or what we call non-sleep deep rest, as soon as possible afterwards. So the way this typically works is you focus hard on trying to learn something. Maybe it's a piece of music. I'm terrible at music, so this would be a good example. And I'm struggling at scales, Then I sleep for a few nights, or I go away from the practice, and then all of a sudden I can do it. This is also true for motor skills. And that's because the rearrangement of neural tissue, the literal rewiring of the brain, occurs during deep sleep. So do and engage the tools for deep sleep. Maximize your sleep 80% of the night. You want to get good sleep. And if you're not getting that, you really should be striving toward that as your #1 priority. Now, in terms of focus, a lot of people say, well, how do I focus? I can't focus. Actually, the best way to get better at focusing is to use your visual system. So unless you're low vision or no vision, in which case you would use your hearing, because my lab does work on visual deficits, and so I'm working all day with people that have visual deficits, but most people can see, and even if you can't see well, the idea is to focus your visual attention on a given target, as this would be a practice. So you could actually set something in front of you. You could even use your hand or your computer screen, turn off the screen, put a visual target on there, and see how long you can hold your gaze there. It's fine to blink. You want to lubricate the eyes. It's one of the main functions of blinking. You can build up your capacity to focus, and you can even just do that exercise for about 30 seconds and then shift into whatever it is you're trying to learn. This actually works great before conversation. So if you're going to have a hard conversation, you really need to focus. You can do this prior. It's a little silly, but believe it or not, there are clinical trials now looking at using these visual focus approaches for things like ADHD. And I think nowadays we all feel like we have a little bit of ADHD with the amount of scrolling on phones, et cetera. And then one other tool here is there were 2 excellent papers published just last year in excellent cell-press journals, peer-reviewed journals, showing that non-sleep deep rest, just relaxing, not looking at your phone, just doing some breathing and just kind of chilling out for about 20 minutes after a learning bout, or taking a 20-minute nap or so, can greatly accelerate learning. The rule on naps, however, is if napping prevents you from getting to sleep at night and adequate deep sleep, then you shouldn't be a napper. And nobody should be napping for more than 90 minutes during the day, because that can really disrupt your sleep cycles. So focus and rest. Learning to toggle back and forth between those is going to, in my opinion, is going to be far more effective and in concert with your natural biology for learning and memory than any kind of app or tool. But there's some decent apps and tools out there. I'm mainly focused on the underlying biology and the natural mechanisms.
Okay. Does that nap or rest have to happen right after the focus?
Great question. It does not. You have about a 4 to 6 hour window.
Okay.
And of course, getting adequate deep sleep at night is going to be the best thing. Now, anytime you talk about sleep, people develop this kind of sleep-related anxiety, that if you can't sleep, that it's going to completely throw you off. For that, I really want to emphasize the incredible work of my colleague, Dr. Aaliyah Crum, in the psychology department here at Stanford. She focuses on mindsets. And it turns out our mindset about sleep is very important as to whether or not a bad night's sleep really throws us off or not. If you think that you need excellent sleep every night in order to function, you're going to become more reliant on that, and one poor night's sleep will really throw you off. If you believe that your system is resilient and you can perform pretty well, then you'll be resilient and you can perform pretty well. But you can't escape the need for sleep completely. And they've done beautiful studies actually lying to people about how poor their sleep was or how good their sleep was, independent of how well they actually slept, and showing that your thoughts about your sleep performance are really important. And for that reason, and I know I'm going to lose some friends by saying this, that's why I don't wear any sleep monitoring device, because I don't want to score about how I slept. I want to subjectively adjust my mindset and my thoughts about sleep. Some people like sleep devices because it keeps them on track. Some people like to count calories. Some people don't. Everybody's different. Do what works for you.
Okay. I've heard our brains are changing with the use of technology. How can I improve my memory and brain power in this era of Googling everything?
Yes, our brains are changing. This is the first time, at least that I'm aware of, in human evolution that we've typed with our thumbs. Probably the first time in human evolution that we can view 50 movies inside of 60 seconds or so by just scrolling through an Instagram feed. Movies are an incredibly powerful stimulus for our brain and body. They wake us up, but we've never before had to contend with context switching at this rate. I mean, I say never before. I wasn't consulted at the design phase, so I don't know. But we assume that we've never had these kind of rapid context switches all the time. Rapid context switching is terrible for the brain. It's just really not good. But we can contend with it. And so we can scroll Instagram for a while, we can search the web for a while, but I would say for every hour that one does that, we should be spending at least twice as much time in focused, dedicated practices. Now that could be conversation where phones are away. It could be a meal where ideally phones are away and there are no screens. It could be reading a book or even a Kindle. Again, if you're going to read your Kindle late at night, dim that screen way, way down. Even if you're wearing blue blockers, dim it way, way down. So the other thing that our brain evolved to do, we know there's dedicated neural machinery for speaking and hearing. There's also dedicated neural machinery for writing. We weren't really organized with neurons and neural circuits for typing with our thumbs. We've created the ability to do that. So some regular journaling is known to be an excellent practice. Just even the practice of having to write out complete sentences. I mean, even as grown adults, we are now speaking in descriptive clauses. Our punctuation is off because we use texting to just communicate so quickly, or even voice recognition where we sort of all acknowledge, okay, you don't even need to use proper grammar. So constructing proper sentences, forcing oneself a little bit each day to write things out, punctuate, this is enormously powerful, and it keeps the neural circuits associated with language, which is associated with thinking, which is associated with memory, and even better, narrative, if you can take some time to write out stories. and think about things in a kind of story narrative. I mean, we evolved to do that. And so it's not about completely avoiding these technologies. They're here to stay. It's really about offsetting those technologies with some of the other naturally occurring machinery. And it actually just feels really good to write. It feels really good to read. There's a friction to it at the beginning, what I call limbic friction. Your limbic system goes, oh my God, I hate this. I'd much rather scroll Instagram or surf the web or just talk into voice recognition. But when you do it, there's a feedback loop that a few minutes into it, you start to feel like, oh wow, this is really good. And you actually feel like you've accomplished something, and indeed you have.
Okay. So something pretty serious. If someone has a family history of Alzheimer's, do you recommend genetic testing? And is there anything they can do to preserve memory, particularly if they're at increased risk?
Yeah, so this is obviously a very serious issue and a somewhat controversial issue as it relates to the genetic testing, because biomarkers for Alzheimer's do exist. Smoking gun biomarkers they're not quite there, nor unfortunately is there a universal treatment for Alzheimer's that is effective for everybody yet. I mean, obviously if there's age-related cognitive decline and Alzheimer's in your family, contact a neurologist. Talk to them early, right? Ask what the latest and best is in terms of treatments. Once again, we return to the foundational practices though. Quality cardiovascular exercise is going to enhance blood flow to the brain, lymphatic clearance during sleep. Maybe I didn't emphasize this enough before, but by getting that regular exercise, you're increasing the lymphatic clearance during sleep. There's even some evidence that sleeping with your feet slightly elevated by about 10 to 15 degrees can increase lymphatic clearance. This is also why when you go to sleep on a plane or in a chair, you wake up and you don't feel quite as rested. The lymphatic clearance is not quite as robust when you're upright. So adjusting sleep posture. And then of course, there's a lot of controversy about whether or not ketogenic diets are good for Alzheimer's or plant-based diets, or nowadays there are even some extreme versions of everything, meat-based diets, et cetera. There aren't a lot of clinical trials yet to support one or the other, but they're starting to emerge. In the meantime, improving lymphatic clearance, keeping cardiovascular function excellent by the practices that you've heard, I think, from everybody on this panel today, is going to be one of the best things that you can do. Also staying cognitively engaged, we hear that. And then there's also some very good evidence, here I'm showing my bias as a visual neuroscientist, that making sure that you wear the proper corrective lenses if you need them to get sharp visual focus can help offset some of the age-related cognitive decline, because cognitive focus generally follows visual focus. So if you can't focus visually, it's very hard to focus mentally. And we know this, all of us know this by experience. When we're tired, our kind of experience of the world starts to flicker and kind of fade out. So make sure that you're getting regular eye exams, get your pressures checked for glaucoma. I'm putting on my ophthalmology hat there. But keep vision healthy, that's one way. And then, of course, social engagement has been shown to be really, really crucial. So if you have a family member who's somewhat isolated, especially in this time, and there's a concern about age-related cognitive decline, you really want to engage them. And then the sunlight viewing that we talked about before, believe it or not, has been shown to offset some, not just things like the tendency to develop early onset cognitive decline, but there's some interesting evidence about sunlight exposure and MS, multiple sclerosis, and reducing incidence of MS. So the sun is a powerful tool. And again, think about it as these eyes that we call eyes are not just eyes, they're actually two pieces of your brain that are outside your cranial vault, and they're designed to be there in part as a wake-up signal to the rest of your brain. So get that morning sunlight as best you can.
All right, and as we wrap up, can you give us a hint on how to prevent procrastination?
This is the number one question. The number one question I used to get is, how do I keep my memory as I get older? Now the number one question is, how do I avoid procrastination? If I had an answer to this that would work for everybody, well then I'd be on the donor wall of the hospital, and I'm not. And that's where I'd give my money. But the fact of the matter is that procrastination can arrive through a couple sources. It turns out some people, this is for work from the Wharton School of Business, some people like procrastination because they need that stress kick in order to, or a deadline to really get going. I confess I'm one of these people. I'll wait until the last minute, and then all systems kind of go into maximum focus, and I'm most efficient under pressure. Some people are the opposite. They really get stressed out by not meeting deadlines early enough. I was the last one to arrive today, and I think I probably gave people a little bit of a cortisol blip for doing that. I apologize, but that's my tendency. Here's the key. If you want to be less of a procrastinator, you need to be comfortable with adrenaline, also called epinephrine, in your system. Now, epinephrine and adrenaline were designed to mobilize us, not just when predators are chasing us, but in response to anything we care about, positive or negative, getting away from the bad thing or toward the good thing. So the most important thing to do is get comfortable with the fact that in order to lean into action, you're going to have to feel a little bit of agitation, maybe even some jitteriness. And there's actually a breathing tool that one can use to do this. I don't recommend that people who are prone to anxiety attacks or panic attacks do this, but most people can get away with doing this. Don't do it while you're driving or while you're swimming, please. But it's very simple. You're just going to do 25 or 30 very deep breaths. This is actually part of a study that my lab and Dr. Spiegel's lab are working on. You can try this. Just a warning, you will feel really energized and activated because it causes the release of adrenaline in the body and it's equivalent in the brainstem. And I'll do this, it looks ridiculous, but I'll do it since I'm on the spot here. It involves breathing in deeply through your nose and exhaling forcefully through the mouth. Normally when we breathe, we passively exhale. A forceful exhale will also further increase adrenaline. So you do that 30 times. I'm not gonna do it 30 times because you would all fall asleep out of boredom, but it goes something like this. So
Okay, that's good. All
I'm
right,
inhaling as much as I can. They don't want me to breathe on them. And exhaling. As you do that, you're going to heat up. You're going to turn red. You're going to feel activated. You're going to feel somewhat agitated. But you'll be as alert as if you drank 2 cups of espresso. Your ability to focus and lean into physical or mental action after 30 of those breaths is heightened by at least 50%. So a lot of people are procrastinating because they're just not good at going from a standstill to what I call forward center of mass. And they try and come up with all sorts of elaborate schemes, 2 espresso, 3 inspirational videos, wonder if I'm, really want to do the thing I'm procrastinating about. The goal is to lower what we call your activation energy. The best graduate students and postdocs in my laboratory and that I've ever observed, and it seems all physicians, seem to have this quality of having very low activation energy. You say, we need to do this, and they're already walking down the hall to do it. And then there are people like me that are a little bit more like lazy, like my bulldog was, where you tell them to do something and they might move their eyeballs. The key is to get into action quickly. The key to getting into action quickly is to leverage the adrenaline system. And you can think all day about tricks to manipulate yourself into getting out of procrastination into action. I say when your brain isn't functioning the way you want, use your body to shift your brain into a forward center of mass.
Okay, thank you. All right, thank you to all of our speakers for joining us today. Before we leave, we have one last question that I'd like to ask each one of you. So if you could remove your masks. And as people in the medical field, we generally know how to stay healthy. But even we slip up. So after today, what would you say is the single best thing you are going to do or that you do for your health on a regular basis? All righty, Dr. Riley.
So the thing I've been doing, I actually was taught by a patient. I have a lovely patient named Billy that I've known for years. And every visit, he tells me about meditation. Every visit, Dr. Riley, this is the best, right? I'm like, okay, Billy, and he brings me mantras and book suggestions. So COVID comes, figure I got nothing to lose, and it's the best thing I have done in years. And I owe it all to Billy, and I tell him every time he comes for a visit. Now doing will be the sighing. I'm not so sure about the second breathing technique of Andrew's, but I am totally down for the sunlight and the sighing exercises. So I thank him for that.
Excellent. Dr. Wu.
So I try to exercise every day. Sometimes you don't feel so motivated, but I aim for most days of the week, and alternating between cardio, strength training, and flexibility. And it's just a habit that I've tried to build into my life. Some days it works better than others.
Fabulous. All right.
The morning sunlight viewing that I described is a non-negotiable in our household. So if I wake up before the sun comes out, I'll turn on bright artificial lights, but the moment that the sun is out, I'm outside. We're outside for 10 minutes at least, maybe walking the dog, but non-negotiable every day, even on vacation. Even if it makes us late to places, I do not negotiate it. And I am totally unapologetic about it because it sets everything in the right motion.
Okay. All right, Dr. Sai.
I commute to work on a bike, and that is, I have to get to work anyway, so cycling is such a great way for me to do it because it helps me meditate on the way to work, and on the way home, it helps me decompress. So it's actually really fantastic, and I love it.
And that's like multitasking several of these things, like all at once. So that's great. I think I'm going to try the morning light thing, and I'm going to try the not making my stand-up desk just another countertop, actually trying to stand, and then some resistance training. So thank you all for your great ideas and insight. It's been truly an honor to be with you here today, and thank you to all of you who joined us from around the globe. We'll be providing a recording of today's program to everyone who attended. Please share it with the women in your lives and encourage them to take time for their health. Thank you so much. Stay safe and be well.